My name is Elizabeth Smith, and I'm the Assistant Vice President of Regional Integrated Behavioral Health Services at Promesa Inc., an affiliate of Acacia. Alba de Vida provides substance use and mental health treatment services for anyone with substance use disorder. We are an outpatient program licensed by Oasis. We currently also have a medication mobile unit about to launch where all of our brick and mortar services will be offered also on the medication mobile unit to include medication-assisted treatment, counseling, peer services, and a very comprehensive integrated program. The benefit to our clientele is that they can come here for treatment, and then we have all the wraparound services of Hispanos Unidos de Buffalo.
My name is Suzanne Diaz-Torres, and I do quality improvement here at Alba de Vida. We're here at Alba de Vida. We are a clinic that offers clients that suffer with substance abuse and mental health services. We try to help them get back to a productive way of life, ensuring that all their needs are met with substance use and housing. We have peer services to help clients fill the gap between the counselor and the client. A lot of our clients are below poverty level. Many of our clients are also on Medicaid.
We do have about 25 to 30% of our population is Hispanic, and they are from the local community here in the West Side on Virginia Street. We have an array of people coming from all different walks of life. The majority of our clients actually come voluntarily. They come wanting treatment, asking for treatment, and we also have people being referred to us from the courts, post-incarceration, and from other providers, obviously, in the community. We take Medicaid managed care, all insurances, and we also do have sliding scale self-pay options that a person can pay out of pocket if need be. We do have an entitlements team that will assist anyone coming through the doors to get health insurance if they do not have any. We work with everyone to be able to meet where they're at.
William Ryback, 41. I was in the Marine Corps, generally did construction for work. I'm starting a company now. I was using heroin for like years. I just didn't know what methadone was. I thought it was like Suboxone or other stuff, and then the drugs changed on the street and that stuff didn't even work. And things were just really scary out there, and I wasn't going anywhere, so I found this place approximately 2 years ago. The only concern or care was not being sick, and that's what I think we all run from. People think it would be, you should be afraid of dying, but you really don't even think about that. You just don't want to be sick. Came here, and within 2 weeks, nothing else worked, and that stuff did its job. I stopped using within 2 weeks, and haven't since. I started looking into clinics, and I found that this place, I seen it was on Virginia. I didn't even know that it was a clinic. I used to walk by here and I didn't even know. When I found that out, I stopped in.
We have a lot of happy clients, and the clients that also have a lot of trauma in their life. And it's very difficult for them to find themselves and to get acclimated back into the community with those two things working against them, like the mental health and the substance abuse. They do experience a lot of hardships, stigma, broken relationships, healthcare, transportation, and finding mental health services. So what we do is we try to create like a one-stop shop where these clients can come in, fill out paperwork, hopefully get the same day access where they can begin their treatment and begin their recovery goals, and then link them to the other programs that we do have under the Acacia umbrella.
Before coming here, a client is very much challenged with how the substance use or mental health conditions have impacted their life. For everyone, that's different, depending upon what walk of life they've had.
There's a big stigma on using, well, any drugs, but heroin in particular, and particularly IV heroin use. You're looked down upon, and you're treated different in the medical industry. When you go to hospitals or anywhere, you go seek medical attention, as soon as they see that you're an addict, you're put to the back of the line. It's very discouraging. Well, you're not treated like that here. You feel like you're just another person, you know? That's the beginning. Once you start getting treated normal again, you start remembering what things were like.
We do not have a cookie cutter approach, and we do person-centered care. So what works for one may not work for the other. So it's a lot of encouragement. It's meeting with your client just to really figure out what's being said and what's not being said, and really trying to motivate the client to get involved in the community and get the services that they need.
I can definitely say we've done a lot of trauma-informed care and trying to set a trauma-informed care environment, fine-tuning the quality of services and the way that we provide them. That's our newest initiative, and really trying to create a very, very real trauma-informed care environment altogether with the treatment. Our staff basically look like the people that we serve. We are a very multidisciplinary cultured team. We serve everybody and anyone. The key is that when you're serving people, your staff needs to look just like the people coming and being served.
We have great people here, the staff that continue to encourage them and to go out and seek third parties to also link them with, to make sure that they have their housing needs. To see clients actually graduate or to get off of methadone, that they completed the program, that they don't need medication therapy anymore. And just seeing people being reunited with their family again. They do all the work, they do all the steps, take all the classes, and then finally they bring in a picture of them visiting with their child. For me, watching the clients finally notice all their hard work has paid off has been very, very rewarding.
I have goals and aspirations for the future. I mean, now I go to work, I have a social life again, I enjoy going out, and you just never enjoy that stuff when you're stuck in addiction. Having a clear mind and knowing that I'm not going to wake up tomorrow and have to go through this whole process, getting drugs so I'm not sick. It's kind of cliche, everyone says the simple things, but it really is that you cherish so much, and you didn't even realize they were gone until you wake up and you find yourself cooking bacon and eggs for breakfast when you couldn't even smell it before, and spending your money on things for you. That's what it's for. That's what you make it for, not drugs. Just nice clothes, and starting a company now. I'm buying the tools, and it hasn't even been 2 years, and I just never thought it would be so quick. Whether it's a concert, whatever you like doing, you never look forward to that when you're using drugs.
Every individual comes in with their own story and their own testimonial. When they make it in here and just put their foot into the door, acknowledging and wanting help, that in itself is a success story, and one that we want to continue to be able to get people into treatment and let them truly believe that they have their own success stories of where they wind up and where they want to be. We want to encourage people to just stepping into the door is the biggest success story of all.